Medicare open enrollment period, or Medicare annual election period. What is it, when is it, and what should you do during that time? I'm Devin West and I run Medicare Savings Solutions, and in this video I'll answer those questions for you. The first question was, what is the Medicare open enrollment period? Well, it is a certain time of year where, if you so chose to, you could change your plans to better suit you for the following year. There are limitations on what you can do during this time, and you can't change all plans in all situations. So we'll go over that on the third question. The second question was, when is the Medicare open enrollment period, or Medicare annual election period? Well, that is between October 15th and December 7th of every year. Then there's also a period between October 1st and October 14th, which is the pre-open enrollment period or pre-annual election period, where agents and plans can show you the plan's benefits, but they cannot enroll you into a plan at that time. They have to wait until October 15th to accept any applications from you. The third question was, what should you do during the open enrollment period, or what can you do during the open enrollment period? Well, this is a time that you can evaluate all of your plan options, and if you need to, you can change from one plan to another for the following year. If you're currently on a Medicare Advantage plan or Medicare Part D prescription drug plan, in late September, you should get an annual notice of change letter. These show the differences in your plan from this year to next year, and you'll be able to evaluate whether your plan is changing significantly or not. During the open enrollment period, you'll have all of the plan benefit information available to you for the following year. At this time, you'll want to review your plan options to make sure you're still on the plan that's best available for your specific needs. So a few examples of what changes you can make at this time. You can move from a Medicare Advantage plan to another Medicare Advantage plan, from a Medicare Part D prescription drug plan to a different Medicare Part D prescription drug plan. Or you can move from a Medicare Part D prescription drug plan to a Medicare Advantage plan, or you can move from a Medicare Advantage plan to a Medicare supplement plan and a separate prescription drug plan. That is if you qualify for the Medicare supplement plan. In most cases, when you go from a Medicare Advantage plan or just original Medicare to a Medicare supplement plan, you do have to qualify medically on most plans in most areas. So again, the big point of the Medicare open enrollment period is to give you a time frame where you can review your plan options to make sure you're still taken care of with the best plan to fit your specific needs. Plans can change every year. Co-pays, monthly premiums, and benefits change every year. So you really want to make sure that you're taken care of for the following year. Like I said in the beginning, I have a couple tips for you guys going into the Medicare open enrollment period. Tip number one, don't get sold. That is the number one tip, just because at this time you'll be bombarded with all kinds of information from all sources, from people knocking on your doors to mailings and phone calls. So you want to be careful during this time period, because a lot of people will be trying to sell you what they call the best plan. Oftentimes coming from the companies themselves, every plan is the best plan because they are trying to sell it to you. And so you really want to be careful and make sure you don't get into a plan that might make it harder for you for the following year. A big problem I see with my experience is that a lot of people will change plans for $5 difference in co-pays or $5 difference in premiums when they actually have a pretty good plan and it's stable and has a large network of doctors or good prescription costs, that kind of thing. And so when you change that, you have to be careful, because you may have different doctors' choices, you may have different medications that you have to get prior approvals for again, or all kinds of different things that can go into changing plans that might make it hard for you for next year. It can be a hassle sometimes. So to round up tip number one, only change plans if it's going to make a significant difference for you for the next year. Tip number two, talk to an independent agent like us with Medicare Savings Solutions that can offer you all the top plans with all the top companies and help you decide which plan might be best for you for the following year. We'll do a complete review of your current situation. We'll take into account your doctors, your prescriptions, your health issues, your finances, and we don't care which plan you go with as long as it's the best plan for your specific needs. So if you'd like free help choosing a plan, you can call us at 1-800-663-5707. We have many different videos you can watch on our Facebook, on our YouTube, or on our website. Just search Medicare Savings Solutions and you should find those very easily.